Pandemics, outbreaks of disease on a global scale, have shaped the course of human history. They leave a trail of devastation, fear, and societal change. From the Black Death in the 14th century to the Covid-19 pandemic in recent times, these events have tested our resilience and forced us to confront our vulnerabilities. Understanding the impact of past pandemics can offer valuable lessons for navigating present and future health crises. Throughout history, pandemics have been accompanied by fear, uncertainty, and social disruption. They have challenged our understanding of disease, exposed inequalities, and tested the limits of our healthcare systems. However, they have also sparked innovation, fostered collaboration, and led to advancements in medicine and public health. By studying the responses and consequences of past pandemics, we can gain insights into the complexities of disease outbreaks. We can also learn how to better prepare for and mitigate the impact of future threats. The history of pandemics is a stark reminder of our interconnectedness and the importance of global cooperation in the face of shared challenges. The Black Death, a devastating pandemic that swept through Europe, Asia, and Africa in the mid-14th century, stands as a chilling example of a pandemic's power to reshape societies. Caused by the bacterium, the Black Death, also known as the bubonic plague, arrived in Europe in 1347, carried by rats on trading ships. The disease spread rapidly, claiming an estimated 75 to 200 million lives, nearly a third of Europe's population. The Black Death's impact extended far beyond its staggering death toll. The pandemic brought about profound social, economic, and cultural changes. The sudden and massive loss of life led to labor shortages, disrupting agricultural production and trade. Cities and villages were decimated, leaving behind a haunting silence. The Black Death's impact on medieval society was all-encompassing. It transformed religious practices, art, and literature, reflecting the widespread fear and uncertainty of the time. The pandemic's devastating effects left an enduring mark on the collective memory of Europe and continue to fascinate and horrify us centuries later. One of the most significant consequences of the Black Death was the upheaval of the medieval labor system. The massive death toll created a labor shortage, empowering peasants and weakening the grip of the feudal system. With fewer workers available, landlords had to compete for labor, offering higher wages and better conditions. This shift in power dynamics challenged the established social order. Peasants, once bound to the land, gained leverage to demand better treatment and greater freedoms. They migrated to cities in search of work, contributing to the growth of urban centers. The scarcity of labor also spurred technological innovation, as landowners sought ways to maintain productivity with fewer workers. New agricultural tools and techniques emerged, further transforming the medieval economy. The Black Death also sowed seeds of distrust in authority. People questioned religious institutions and traditional beliefs as they struggled to make sense of the devastating pandemic. The Church, once a source of solace and explanation, was seen as failing to protect its followers from the plague's wrath. This erosion of trust in traditional institutions contributed to social and religious reforms in the centuries that followed. Centuries after the Black Death, the Covid-19 pandemic emerged as a stark reminder of the enduring threat of infectious diseases. Caused by the SARS-CoV-2 virus, Covid-19 spread rapidly across the globe, impacting every facet of modern life. Like its predecessor, the Black Death, the Covid-19 pandemic has exposed vulnerabilities in our healthcare systems and highlighted the interconnectedness of our world. The pandemic's reach extended far beyond the realm of public health, impacting economies, education systems, and social interactions. Lockdowns and travel restrictions became the new normal, disrupting global supply chains and leading to widespread job losses. The pandemic forced us to adapt to new ways of working, learning, and socializing, accelerating the adoption of digital technologies. The Covid-19 pandemic has had a profound impact on mental health. The uncertainty, fear, and social isolation brought on by the pandemic have taken a toll on people's well-being. Healthcare workers on the front lines of the crisis faced unprecedented challenges and risks. The pandemic has tested our resilience, but it has also revealed our capacity for compassion, innovation, and collective action. Section 5. Public Health in the Age of COVID-19, Challenges and Concerns. The COVID-19 pandemic posed unprecedented challenges to public health systems worldwide. The rapid spread of the virus overwhelmed hospitals and healthcare workers, exposing limitations in resources and preparedness. The pandemic highlighted the importance of robust public health infrastructure, disease surveillance, and international cooperation. One of the key challenges was the development of effective vaccines and treatments for COVID-19. The scientific community mobilized quickly, achieving breakthroughs in record time. The development and distribution of vaccines offered a glimmer of hope, but challenges remained in ensuring equitable access globally. The COVID-19 pandemic also underscored the importance of public health communication and trust in scientific expertise. Combating misinformation and promoting accurate information became crucial in controlling the spread of the virus. Public health officials faced the daunting task of communicating complex scientific information clearly and effectively to a global audience. Section 6. The virus of misinformation. From rumors to conspiracy theories, pandemics have often been accompanied by a shadow pandemic of misinformation. The Black Death was no exception, with rumors and conspiracy theories circulating alongside the disease itself. People blamed foreigners, religious minorities, and even supernatural forces for the plague, leading to persecution and social unrest. In the digital age, misinformation has spread with unprecedented speed and reach. Social media platforms, while providing valuable tools for communication, have also become breeding grounds for false claims and conspiracy theories about COVID-19. Misinformation has undermined public health efforts, eroded trust in scientific expertise, and fueled vaccine hesitancy. Combating misinformation requires a multifaceted approach, including media literacy, fact-checking initiatives, and responsible use of social media platforms. It also highlights the importance of clear and transparent communication from public health officials and trusted sources of information. Section 7. Navigating economic recovery, a post-pandemic world. The economic fallout from the COVID-19 pandemic has been profound, with businesses shutting down, unemployment soaring, and global supply chains disrupted. Governments worldwide have implemented massive stimulus packages and support measures to mitigate the economic damage. The pandemic has accelerated existing economic trends, such as the shift towards automation and the gig economy. It has also exposed inequalities, with marginalized communities and developing countries bearing a disproportionate burden of the economic impact. Navigating economic recovery requires a long-term perspective, focusing on sustainable growth, job creation, and addressing systemic inequalities. It also presents an opportunity to rethink economic models, prioritize social safety nets, and invest in resilient infrastructure. Section 8. Learning from the past, shaping public health strategies. The COVID-19 pandemic has provided valuable lessons for strengthening public health systems and preparing for future health crises. It has highlighted the importance of investing in public health infrastructure, disease surveillance, and international cooperation. One key takeaway is the need for robust early warning systems to detect and respond to outbreaks quickly. Strengthening global health security requires collaboration among nations, data sharing, and coordinated responses. The pandemic has also emphasized the crucial role of public health communication and community engagement. Building trust in scientific expertise, addressing misinformation, and tailoring messages to diverse audiences are essential for effective public health interventions. Section 9. Conclusion. A legacy of resilience. Pandemics, from the Black Death to COVID-19, have left an indelible mark on human history. They have caused widespread suffering, tested our resilience, and forced us to confront our vulnerabilities. However, they have also spurred innovation, fostered collaboration, and revealed our capacity for compassion and collective action. By understanding the lessons of past pandemics, we can better prepare for and mitigate the impact of future health crises. Investing in public health infrastructure, strengthening global health security, and fostering trust in scientific expertise are crucial steps towards building a more resilient future. The legacy of pandemics is a reminder of our interconnectedness and the importance of working together to address shared challenges. By learning from the past And embracing a spirit of cooperation, we can navigate the uncertainties of the future and build a healthier and more resilient world.